Great. Warm welcome, everyone, to day 2 of our 4th Infodemic Management Conference, Advances in Social Listening for Public Health. I really appreciate everyone joining us here today, and I'm going to share a little housekeeping slide deck to help kick things off. So bear with me as I load that. Excellent. So I wanted to take a couple minutes here just to recap on some highlights from day 1, and then I'll go on to some housekeeping business. So on the 4th of May, we had the first day of our conference focused on case studies in social listening, and we had some really interesting presentations from different regional and country teams and partners. And one of the things that really came out strongly from that day was, one, the extraordinary social listening work that is already happening for public health and feeding into the COVID-19 response, but 2, some really key challenges in terms of trying to do social listening both online, through social media, and offline using other methodologies. And so the focus here for us today on day 2 is to pick up from there and to present some new tools and techniques to advance social listening for public health. And so I'm really delighted to share the agenda with you in a moment to show you what we have in store for us today. But first, a little bit of basic business. I encourage everyone to make sure you've also registered for day 3, the final day of the conference on the 12th of May. The link is here. And I also wanted to flag up that today we have interpretation available, so you can toggle in the Zoom chat to the interpretation room if you would like to hear the presentations in French. And I want to encourage active engagement throughout this. So we have presentations, yes, but we also want to have Q&A, and we're going to have some moderated discussion later as well. And really, this is about sharing lessons learned. So I encourage everyone to share your questions throughout the session here today in the Q&A box in the Zoom. And I encourage all of our experts who are present to monitor those questions as they're coming in and answer them to share your expertise. Now, the meeting, I want to clarify here, is being live streamed and recorded, and it's also going to be made available on our EpiWin WHO YouTube channel. And there's a link here for you to subscribe to that. So that will enable you to share it more widely with your networks for anyone who missed today. And I also encourage everyone to share the lessons you're learning here on social media using the hashtags Infodemic and Infodemic Manager. Now, looking at the agenda for us here today, I want to introduce our partners from US CDC. We have Ms. Muriel Kone and Mr. Atsu Ishizumi, who we're delighted to have as moderators for today's session. Atsu and Muriel, do you want to wave hello? Say a quick hi. Great. Nice to see you. And before I pass over to the moderators, a quick overview. So we're going to have several sessions of presentations and question and answer. So we'll start off here with a couple presentations, 15 minutes each, followed by a quick Q&A, and then we'll move on to the next session of presentations, and we'll end the day with a moderated discussion. And for that, I want the speakers to be prepared to get some exciting questions thrown your way that are coming in through our Q&A channel. So with that, I would actually like to hand over to our moderators, Muriel and Atsu. And Muriel, do you want to kick us off for the first session?
Absolutely. Thank you, Chris, for that introduction, and welcome again to everybody, and for joining us for the second day of the Infodemic Management Conference. As Chris mentioned, I'm Muriel Kone. I'm a health communicator with CDC's Demand for Immunizations team within the Global Immunization Division. And so we have a series of interesting presentations for all of you guys today. And our first focus is on the tools and techniques for listening to communities to strengthen public health. And I am pleased to welcome our first presenters, Ms. Tina Pernat from the European Center for Disease Control and Prevention, Ms. Amy Wright, and Ms. Lucy Lavery from Media Measurements, and Dr. Yves Dubé from the Quebec National Institute for Public Health. They will lead us up on a presentation on localized application of the global media measurement and EpiWin digital research taxonomy work in Quebec. Tina, Amy, and Dr. Yves, over to you.
Okay, I think this works. Hi, everyone. This is Tina. Just before I start off the talk, I want to also point out that I'm here today on personal, in a personal capacity as an expert in this topic, and my views do not represent the views of ECDC. But I am very pleased to be here with colleagues from our colleagues Amy and Ev to talk to you about using public health taxonomy as an approach to understanding social media conversations. And why is it important to think about using a taxonomy for social listening? When we actually started this this analysis and started thinking about last year on how to help analyze and sift through the really a large volume of conversations online, you know, we really learned that we need to have an approach that would help us cut through the conversations and save us some time, so that we could focus and that the risk communications colleagues could focus more on priorities and action and not so much on analysis. So this taxonomy that Amy and Ev will present really allows us to preset relevant categories for listening. They're pre-identified, and this makes it easier to then structure the analysis and link it to the response and the mitigation of epidemic risk. This is really important, especially during the response, epidemic response. And of course, such a targeted analytical approach then zeroes in really fast on those conversations that where questions occur, where confusion is, where information voids exist. And then, of course, that saves time and allows then, you know, the team to really focus resources and time on priorities and action and agile action. And you know how this was done, Amy will explain, and then Ev has some really good examples of how this was used actually practically by her team and group in Canada. So Amy, over to you.
Thank you very much, Tina. So yes, hopefully everybody can see my screen. That would be a really good place to start. So yes, the taxonomy that Media Measurement co-created with the World Health Organization at the beginning of the pandemic in March last year was designed to cut through the vast volumes of digital content being generated on the topic of COVID-19 so that we could focus on content that has public health implications. Between March 2020 and now, Media Measurement has used the taxonomy framework to analyse over 1 billion items of social media content from across the world. And we've probed that data in order to understand what has driven increased online discussion around key topics. Now, that 1 billion represents 3% of the publicly available social media conversation globally on any topic, and it's an average of 3.3 million social media posts a day. So this is a gold mine of unstructured data, accessing citizen questions and concerns that may signal information voids and provide insight into citizens' unconscious or deliberate misinterpretation of facts. With that said, each question and concern can come with different levels of urgency, of response, and different implications for communication strategy. So the analysis based on the taxonomy is designed to allow WHO and its partners to identify and leverage potential opportunities to address information voids or to counter misinformation by focusing on rising topics of concern and the questions that people are asking in the digital space. So the isolation and identification of questions and concerns within millions of social media posts mentioning COVID-19 daily and at a global level comes with its challenges. From time constraints to deliver timely reporting, to the implementation of an analysis process that is able to capture nuance and indeed how different aspects of the conversation on the virus are intertwined with other issues. And in order to address these challenges, structure is key. We collect billions of public English and French language social media posts from Twitter, Facebook, blogs, forums, including Reddit and Instagram, through our data aggregation provider using keyword detection. When it comes to data aggregation and proper data analysis, instead of analysing the conversation holistically, we segment the data into 4+1 main conceptual areas that can better speak to public health individuals. So those are the cause, the illness, the treatment, and the interventions. And then the fifth category is what we call information, which is a segment that looks at how civil society discusses information specifically about the virus online, from meta conversations on misinformation, data and statistics, as well as an overview of the key sources or key influencers being discussed. Within each of these taxonomy areas, we track 35 topics through which civil society discusses the virus, including stigma, symptoms, risk to certain individuals, travel, testing, technology, and of course, treatment and vaccines. This first layer of compartmentalization gives us an overview of the most and least popular themes discussed online in conjunction with COVID-19, but also an understanding of topics that are most likely to resurface again and again, even after appropriate communication has been put out, such as how COVID-19 immunity works, asymptomatic transmission, or COVID-19 risks in children and pregnant women. On top of this layer, we also track questions by pairing our keyword detection infrastructure with question syntax detection in French and English to pick up information voids requiring immediate attention. Also, as part of our analysis infrastructure, we can detect fluctuations in emotions expressed in social media conversation on COVID-19. And we do this using keyword detection that picks up occurrences of 6 emotions in particular, which are denial, sadness, anxiety, fear, anger, and acceptance. The taxonomy structure works as a large-scale signal detector. We build and expand our database on a weekly basis whilst trying to keep track of how online interest in the tracked aspects of the COVID-19 pandemic is evolving. Each week, we examine a custom-built data dashboard, which tells us which topics have gained velocity on a given week, which is to say have increased in the volume of mentions. This focus on velocity, rather than purely volume, allows us to provide WHO with early warning of topics that may be about to become an issue. This horizon scanning enables WHO and partners to take a more strategic and proactive approach to public health communications, particularly with media measurements, insight capabilities targeted towards those topics that have been increasingly discussed by digital active civil society. We have an experienced team of analysts which identify key stories that have engaged users globally, picking up areas of concerns, more frequently asked questions, and contextualizes them in detailed reports that illustrate what the main issue is, which aspects of each theme are engaging users the most, and where in the world the issue is most severe. We complement that base data set from the taxonomy with cross-references from other data sources, including search data, to draw that bigger picture. And finally, we provide evidence of confusion or fertile ground for misinformation that may require a prompt communication response. Even as we began to roll out weekly reporting at a global level at the start of the pandemic, we were already having discussions about how our co-created taxonomy might be useful at a more localized level. We started having conversations with potential partners about how they may be able to use the insight, including WHO Southeast Asia. And those of you who attended day 1 of this conference would have heard Dr. Supriya Besbarua share the work that we do with her, part of which is based on this global taxonomy. We've also run pilot studies for individual countries, delivering insights based on the deep dive analysis of digital conversations in Malaysia, Mali, and the Philippines. We also began working with the public health team in Quebec to provide supporting data and insight to drive public health information interventions at a provincial level. In order to do that for Quebec, we thankfully had designed the methodology to be adaptable from a global scope to a local or hyper-local one. That said, the early stages of the adaptation process were key to ensure that local voices would be heard. To achieve this, there were some questions we needed to answer. What does the social media use landscape look like in my target region? Does our data infrastructure reflect that landscape, or do we need to make adjustments? For example, jointly with the colleagues in Quebec, we powered up our Facebook Insight capabilities because, for example, Twitter was not used as widely in the province. This also called for the creation of additional strategies to adapt social media listening to the lack of Facebook's geolocated data available to the public through the inclusion of toponyms, so place names, in our search strings. Last but not least, the localization of keywords does of course require accurate preliminary research. We powered up our search strings to account for phrases or institutions that are unique to the Quebec context to detect conversations on healthcare. And I'm now really happy to hand over to Ev, who's going to illustrate how the Institute has been taking advantage of our insights.
Thanks. So just a note for those who are less familiar with this context. So Quebec is a French-speaking province within Canada. So that means that most of the English discussion outside of Quebec are not really having traction within Quebec. So Quebec has its own TV show, institution, and we often speak of two solitudes, Quebec and the rest of Canada. Next slide. So the most important use of the intelligence provided by media measurement is, of course, to flag rising false information and to adapt our communication strategy. So I've put you the Quebec website that is able to answer questions about COVID-19 and that is frequently adjusted based on rising topic and areas of concern. The work of media measurement also allowed us very early in the pandemic to understand that we were having one of the world-leading conspiracy theories in French. So a very small number of accounts were generating a lot of false and misleading information. And we also have observed the growth of the popularity of these discourses online using the report from media measurement. And because these groups have a lot of influence offline as well. So they organized protests, they took lawsuits against the government, they harassed journalists and public health people, but they also promote a lot of false information about the disease, the measure, and the treatment. So we use intelligence from the report to avoid further contamination by this group, to provide good information for the rest of the public. We know that we won't be able to convince these people to change their mind, but we want to ensure that they don't promote too much false idea to the rest of the public. Next slide. The other very useful information that we get from the taxonomy and the report is an ability to be able to assess current feelings and area of concern within the public. Both the emotion analysis and the discourse provide us a way to tackle the level of acceptance of different measures. So a couple of examples to illustrate. Curfew was implemented in Quebec last January to contain the second wave, and Quebec is the only province in Canada with a curfew. There were few exemptions, but none for people who are experiencing homelessness, and this generates a lot of negative discussion online, and it finally was revoked. But the report from media measurement really allow us to understand that the majority of Quebecers were not against the measure if it was implemented with equity. Another example is the lack of strong measure at the borders to control travelers in the context of COVID-19 variant. This was highly criticized on social media. It's interesting for us, not only in terms of the public desire for stronger measure against the pandemic, but also the feeling of pandemic fatigue and the need to blame some group for not responding or respecting the measure, even if in fact the travelers were not generating a lot of outbreaks of COVID. And on a more positive note, we have observed an increase in the level of support for the different measures in Quebec after the many testimonies of healthcare workers who expressed their fatigue and the burden of their work in the context of the second wave. So that is a positive outcome of online conversation. So next slide. Of course, another useful information for us is to inform communication intervention that are on social media. We can assess the acceptability of some of the campaign. Here are two examples of communication intervention that did not went well. Of course, it's always
1 minute left.
Oh, okay. So I'll skip that. Just to conclude on next slide. Just a note on the importance of putting findings of social listening into context. We triangulate the result with the surveys that we're doing or focus group discussion to have a good understanding of the current level of acceptance. So our work with media measurement for over a year has shown us how the online discourses are polarized and how the voice of the majority of Quebecers that are not opposed to most public health recommendation is often not represented. But the minority of social media users that are strongly against the measure are generating a lot of misinformation, and it's really important to have access to these misinformation to be able to adapt our strategy. So that's it from my part.
Thank you so much, Ave and Amy and Tina, for that wonderful presentation. It was extremely insightful on some of the important work on developing a global taxonomy that can be adapted in local contexts to address infodemics. And as a quick reminder, please continue to post your questions in the Q&A box for our presenters. And now I'd like to introduce you all to Dr. Christine Cerniak from WHO and Mr. Harry Wilson from CityBeats. They will be sharing about the EARS platform and the use of the AI for social understanding and moving beyond brand monitoring. Chris and Harry, over to you.
Thanks very much, Muriel. And checking that you can hear me okay?
Yes, I can hear you.
Excellent. So I'm really delighted to share about how we can move the emerging discipline of infodemic management forward to ensure better access to credible health information and better health for all. And I think we'll all remember just over a year ago, the World Health Organization Director General raised the alarm about the twin challenges of fighting an infodemic while fighting an epidemic. And as we all know, an infodemic is about much more than misinformation. It's also about an overwhelming amount of information and information gaps and confusing messaging that altogether are making it really difficult for everyone to know what to do. So we know we need to better manage our entire communication ecosystem, both online and offline, to ensure universal access to credible health information as a basic human right. And to do this, we need an evidence-based framework to manage infodemics as a key driver of epidemics. And we need to integrate infodemic management into our health security preparedness and response plans so we can more rapidly flatten the infodemic curve, which you see here, to help flatten the epidemic curve. So this means investing more in advancing our social listening capabilities to better understand the spread and impact that an infodemic is having, and to better track changes in narratives over time, because this is what's going to help us more effectively tailor our public health response. We also know that we need to strengthen ongoing evaluations of interventions so that we have strong feedback loops in place for a more adaptive response that's tracking the changing concerns of communities. And so if we go back to the previous slide, Harry, for a second, I want to flag up for a moment here that the World Health Organization Public Health Research Agenda for managing infodemics has called out key areas for accelerated investment in research, including for advancing social listening, also sometimes referred to as infodemiology. And I want to note here as well, you'll see at the bottom a little call out because there are special journal issues coming out this year on infodemiology as part of this initiative that I want everyone to watch out for. But now to the next slide and to the question of how we're applying social listening right now for COVID-19. So there's a lot more ground to cover than I can for a short presentation. So I'm going to focus on one area here today with a few examples, and I'll share a little bit of history briefly first. So starting in March of last year, the EpiWin team at the World Health Organization initiated this collaboration to develop weekly digital intelligence reports to help detect community concerns and sources of confusion. And the aim is to be able to more quickly identify and fill information gaps using trusted sources to help people know how best to protect themselves and each other, especially before misinformation goes viral, potentially filling those information voids. So while offline social listening is also key, knowledge, attitudes, practices, surveys, and focus groups, they're really valuable, but they can take a long time to generate results. And by the time those come in, people's concerns or understanding might have changed. So digital social listening, we're seeing it as a very helpful proxy with some faster indicators of community concerns. That said, it's still a heavy lift for public health teams to try and manually comb through publicly shared comments across the different platforms and subscription services, especially during a health emergency. So you heard in the previous presentation about the social listening public health taxonomy that we co-developed for COVID-19 to help better focus our searches to save our teams more time. Now, these digital intelligence reports are being shared with our colleagues and partners with actionable insights to help target risk communication and community engagement efforts for accountability to affected populations. So this system that Amy and Tina already presented on is ongoing, while in parallel, we're also developing a new tool with CityBeats for automating this kind of social listening approach for insights in near real time. So Harry's going to tell you more about this platform in a moment, but first I just want to emphasize that there's no such thing as a magic dashboard that's going to solve all of our problems. So a really key component, Harry, if you can zip back to the previous slide, a really key component of our social listening program is training infodemic managers from around the world to use the tool to analyze the data and develop infodemic reports with actionable insights that can better inform decision makers for public health and social measures that are more responsive to the needs and concerns of citizens. So our social listening work, it's being translated into action at headquarters, and I'll tell you more about that in a moment here. But first, I want Harry to jump in and share more about this exciting new tool for the social listening toolbox. Over to you, Harry.
Thanks, Chris. Hi, everyone. So let's take a look at the challenges that we're looking to overcome with ears, which are the same ones which inspired us at CityBeats, which is the product under the hood of ears. What we've been seeing is that there's this wave of new technologies in natural language processing and machine learning, but all too often that new technology is applied just to branding or marketing focused efforts. And our mission is to apply it towards public health into something that's usable here. So the big challenges are actionability. How can we make features which are not just about identifying what people are talking about to sell them more products, but more about identifying information voids in the field of public health. We need to raise the bar in terms of the reliability of data quality and more robust analytics tools that are being used. We need to make sure that all of this is scalable across different public health challenges and across languages in a very easy and fast way to set up in a crisis. We need to make sure that information is flowing quickly with near real-time proxy indicators. And ultimately, it needs to be usable. So rather than many tools fragmented across lots of data sources, the vision is to bring it all together in one place in ears. So with that vision, we're already underway. Since the beginning of this year, we're piloting in 20 countries. A couple more are on the way, and shortly we'll be covering all of the WHO regions. This is all about leveraging big data and putting it in the hands of public health professionals who can turn it into action. So we're currently preparing a paper called Developing AI Technology for Social Understanding Beyond Brand Monitoring. And this highlights the different pieces of technology that we've fine-tuned for serious social understanding. And what we'll do today is talk through some of them in the practical application of ears. So looking at the type of questions that you would want to answer when using ears, the first one would be, as an infodemic manager, just to know what's the conversation, what are people talking about, and where should I focus this week? So to do that, we've been building off the back of the WHO social listening taxonomies that you saw in the last presentation. And these are categories like the cause of the virus, stigma around the spread, confirmed symptoms, and there's 39 of these categories being tracked. In this case with ears, we've set that up with the CityBeats semi-supervised algorithm for classification. And what that means is that by giving a couple of examples, 5 or 10 examples of people talking about the cause of the virus, our system uses machine learning to figure out every day, looking for local references, new terms in the conversation, local dialects or like local slang in each country about which other opinions should also count as cause of the virus. So that means for the people using this tool, you don't need to build huge comprehensive dictionaries of each category. And you don't need to worry that if the conversation cover changes, you'll miss it. So it's all about scalability and ease of use. Once you have those categories set up, you can do all sorts of interesting things, like seeing which countries are outliers in terms of the conversation and also which are the rising terms. Chris, do you want to add anything here in terms of how they're being used at WHO?
Yeah, thanks, Harry. I think it's nice building on the point that Amy made earlier about the value in trying to move beyond this obsession with volume. So if we're only focused on narratives that are getting really wide engagement, by that point, it's too late. We're on the back foot in that reactive space, trying to debunk issues rather than identifying through horizon scanning, looking at velocity, those changes in volume over time, what is going to be the next big issue, and trying to more proactively communicate and inoculate people against harmful narratives and fill those information voids more proactively. Over.
Okay, and then another thing we want to do is go from the general all conversation down to the most actionable parts. So for this, we've developed intent detection of what are people asking about and what are people complaining about. This part is done with a supervised algorithm. And what we found was that it wasn't as simple as just saying any phrase which says what, why, when, who, and a question mark. That actually the majority of times is not a genuine question looking for an answer. So we've trained the system on public health data to really look for those actionable questions looking for a genuine answer. The same thing with complaints. We're not looking at insults or negative sentiment. We're looking at really complaints as a definition of where someone's expectations of reality are not fitting with their perception of how things are being done. So the most actionable types of questions and complaints. We're also looking to develop more of these intents, things like trust detection. So maybe just to skip forward, we're also looking at population segments like gender gap detection, and in the future, we'll be looking at more segments like healthcare workers. You can see in the tool, in the ears backend, you can quickly drill down into an important conversation category. You can see how that interacts with other categories. So for example, vaccinations here, we're seeing in Nigeria is very linked together with faith and sources and influences. And then you can drill down all the way to see unsupervised machine learning, which are these conversation clusters. So within vaccines, you can click into safety or people talking about access, and drill all the way down to the individual documents. So this is all about helping you quickly go from seeing the big picture down to the concrete insight. And then I'll hand to Chris to talk about how those insights are turning into real action.
Thank you, Harry. So at EpiWin, we have this process of analyzing the social listening information that's coming in on a weekly basis, and we meet to assess, what are the emerging priorities for action, and then we feed that into initiatives that we're undertaking here at headquarters and in support of regional and country teams, as well as flagging up insights to partners so that they can take action as well. And this is ranging from inputs into the global press conferences that are happening, the Science in 5 videos, to the risk communication and community engagement packages that our team is developing. This includes engagement with global faith and youth networks. And we have an ongoing series of EpiWin info packs and global webinars with live Q&A that we're doing as well. And I'll touch on a few quick examples here. So seeing increasing reports of worrying prescription practices that are happening, I wanted to flag that there's actually a webinar happening today, for example, to clarify therapeutic guidance, including the latest updates. And given increasing questions and concerns that we picked up over so-called quote unquote vaccination passports, and also about vaccination for pregnant and lactating women and for children, I wanted to encourage you to also watch the recent EpiWin webinars on those topics. And the links are included. Great if you want to subscribe to the YouTube channel and also register for those live Zoom meetings, because it's a wonderful opportunity to come and ask questions in real time of the experts there. Now, thinking about moving from the global level to a few quick examples at country level here. So the high level of transmission in India right now, which is worrying, it's created a greater demand for information about home care and home care guidance. And so the risk communication and community engagement team here mobilized to quickly develop a new global package and have been supporting the regional and country team initiatives on this as well. And in Nigeria, you might have noticed on that slide that Harry showed previously, there was a big uptick in conversations around vaccines. And this was largely driven by an influential faith leader raising concerns recently. And so the EpiWin team responded by reaching out to our faith networks, and we organized a confidential listening session to understand the concerns and the rumors that were spreading. And then we provided a technical briefing with Q&A from WHO experts, so those who joined could then share credible information confidently within their networks. And one other quick point I'll raise is we noticed a spike in healthcare worker conversations about vaccines in Nigeria, and we were able to do a deeper dive using the platform into the main questions and concerns driving those narratives and that spike in conversation. And we were able to then share those ideas from the healthcare worker community with the Nigeria Center for Disease Control as an example in support of their ongoing activities. And there was great discussion about, the possibility of having lanyards or badges for the vaccination cards for healthcare workers so that they can role model that they've been vaccinated and to help attest to the safety of the vaccines and encourage others to get their shot as well. And the last one I'll raise here quickly, because I want to make sure we have some good time for question and answer. A few months back, we detected a rumor about forced vaccinations in schools in the Democratic Republic of the Congo. And we alerted our UNICEF colleagues and shared these actionable insights so that they could prepare for outreach to educators, to assist in outreach to parents, to reassure them that this wasn't in fact the case and to share more information about immunization. So with this, I want to emphasize the value of translating these actionable insights into action and invite everyone to sign the petition to engage in infodemic management in your daily life and flag up the next infodemic training session we have coming in June to support people in doing this kind of social listening work. And for more information, delighted for everyone to get in touch. We're still in the R&D phase here for EARS and encourage ongoing collaboration. Over to you, Harry.
I think that was where we were going to finish for today, right? Or I don't know if we're going to talk, if we have time to talk about next steps for EARS.
Maybe we can do that in the Q&A. Should we do, Muriel, do you want to come in for questions and answers?
Yes, I would love to. And I think we are at time. So you guys made good use of the time today. So thank you both for your wonderful presentation. I think now we would transition into the Q&A sessions. And maybe I can start with you and Chris and Harry with the first question. So we had a question about if you can sort of tell us, what's next on the horizon for ears and where do you go from here?
That's a great question. So currently, I just mentioned we're in the R&D phase here. We're in the process of adding more countries and languages to the platform and would be delighted for people to use the open access dashboard and share your feedback. We also welcome collaboration. So that addresses the upscaling. I should say as well that the platform, we're currently focused on using our COVID-19 taxonomy that we've developed, but certainly this kind of approach is applicable to other health challenges. This kind of ongoing monitoring could be routine, looking at myriad health challenges from, Ebola outbreaks, influenza outbreaks, looking at tobacco, alcohol, other health issues as well. So we are very encouraging of collaboration in this space. This is also a part of a broader social listening program we're developing here at WHO. So this conference is a wonderful stepping stone and contributing to our ongoing development of social listening guidance. And we are also working on global training. The next one is coming up in June, and we'll pop the link here in the chat. And we're also preparing for regional trainings, including country focal points as well. And I should mention that I think Harry raised earlier that one of the challenges for the public health teams is trying to cobble together information from a bunch of disparate sources. And so we really see opportunity to make EARS a one-stop shop of sorts, bringing in different data sources for triangulation. And for those of you who attended the first day of the conference, you will have noticed the press release and the great presentation from our colleagues at UN Global Pulse talking about the development of a radio speech-to-text translation tool. And there's the ability to use narratives coming from radio programs that are captured in structured data and upload that to the platform to triangulate with messaging that's coming from digital intelligence. And there's so much value in doing that kind of work because there are marginalized communities that are going to be more reliant on radio transmissions than information coming through social media, for instance. And of course, behavioral data, it's a challenge because it takes a lot longer to pull it in, but it has incredible value. And so here we get these really fast indicators of changing community concerns. We can develop theories to test and then go and do focus group discussions or key informant interviews or knowledge, attitudes, practices surveys or SMS surveys and test those ideas and do some deeper dives into trying to figure out what the behavioral drivers are for changes in attitudes. And because we can upload other structured data into the platform, there's the opportunity to also look at the incorporation of information coming in through chatbots. And WHO has been working on chatbots for COVID-19, so questions coming in there could be incorporated as well. Harry, do you want to talk a little bit about the analytics?
Yeah, as mentioned, one of the main focuses of EARS is making sure that we extract something actionable from that text, from those opinions. So we're going to keep moving in the direction of more intent detection beyond questions and complaints, and then also being able to apply that to topic areas beyond just COVID-19. So looking at vaccines in COVID-19 or vaccines in general. And then we're also working on some new features such as trust indicators, which could be applied to the vaccine topic. So looking at trust or lack of trust in certain vaccines. And then also looking at indicators from the text, like rumor cues, if we can also get a quick read on those as well.
Great. And I guess I should probably emphasize here too, the value in being able to disaggregate by these different intents is to help save teams time. So it's incredibly useful to be able to quickly check in if a conversation is being largely driven by questions where there is a lack of information. And that tells us that maybe we need more guidance, or maybe guidance is being caught in a particular echo chamber and we need to try and expand the reach to other networks and communities there, or if there are complaints that are really focused on frustration with a particular element of a health program of public health or social measures, and maybe there's a need for more reassurance or an adaptation of the approach for some of those logistics. And then flying up a final point here really quickly, because I want to hear more questions coming in for the other experts, is the need to complement this kind of social listening work with also analysis of the communication network itself to try and identify those key influencers. Yes, that's a part of it, but also pick up where there are isolated communities where there's a lot of polarization, so we can figure out how to try and improve outreach so that everyone has access to credible health information, and to also be able to detect the difference between authentic narratives that are driving conversation from citizens versus disinformation campaigns. Over.
Thank you, Chris. Thank you, Harry. And we do have some questions for the media measurement team. One question came in for Amy, which is, can you sort of tell us about using the social listening taxonomy approach for even more targeted analysis? So for instance, there are a lot of assumptions about the impacts of misinformation on vaccine acceptance. So it's helpful to question these assumptions with data.
Yes, thank you very much. So, yeah, so we do quite a lot of work to identify and to address rumours and misinformation in the work that we do. It's sort of one of the key parts really of the reporting that we do, is to identify information voids, so that we can give that information to the teams at the World Health Organization and their partners so they can address those gaps, and also looking at misinformation. So I think that is a key part of it. Another thing that we do that we've sort of been rolling out since the beginning of the year is looking at vaccine acceptance. And I actually do have some slides that I can very quickly share on this. Let me just get those up and ready. Okay, so again, hopefully everybody can see my screen. So yeah, so we have in addition to the taxonomy that we've already spoken about, we also have a model that helps us to better understand vaccine questioning narratives that are happening on social media. We piloted this in the UK at the beginning of the year as the UK started to roll out a vaccination programme, and we really wanted to use that as a test case to see if it was possible to use social media data to track levels of vaccine acceptance and questioning as expressed by citizens on social media. So we created this model. It's called the Santee Model. It started just being santé, which obviously is a lovely, neat French word for health, but then we realized we needed to add in some new aspects to it. And it's a lexicon-based model that's designed to provide an easy to understand vaccine acceptance score that quantifies the net level of acceptance expressed for vaccines on social media on a daily, weekly and monthly level. And in addition to the data, we also have analysts sort of checking the data and providing qualitative commentary to drive understanding on the key stories, topics, influences that are driving acceptance or questions each day. This is the model, so you can see all of the various different aspects that are sort of key to understanding the acceptance here. So the first strand really to the research is that sort of tracking of the net acceptance level. And the second is this really. So it's an understanding of specific concerns around vaccines, which is, say, based on the aspects that are listed on this slide, which we found to be quite key drivers of acceptance or questioning. So do people think vaccines are necessary? Do people trust those involved in research, production and distribution of vaccinations? So yes, we trialled this model in the UK. It was a publicly available service based on UK data. Emails were sent out daily to people subscribing to that, containing an analysis of those key topics and understanding what was driving changes in acceptance. We're also currently delivering this to Uruguay via UNDP. so that they're also getting access to that data. And yeah, just this is then kind of, I think, then enabled us to roll this out further. So we've also delivered some of this type of information to Chris and her team to understand some of the areas of concern and acceptance as well, in areas where there's been sort of particular levels of concern. So we're using that and a blend of the other methodologies, including the taxonomy and also this model and other social media tools as well, so audience analysis, all of that kind of stuff, to deliver some actionable insights to just drive public health information interventions and to help address information voids, particularly that can drive acceptance of vaccinations.
Great, thank you, Amy, for that. And we did have a question for Eve, and it was really related to how you assess the impact of an intervention. Eve, and if you can keep this very short, that would be great as well. Thank you.
Thanks. So we're looking both at communication, the number of clicks and things like that, but we also are doing surveys and focus group discussion where we explore what people have understood of the intervention we did. So we have both social listening as a way to see the spread of the campaign and the reach of the campaign and who's sharing the campaign, but also other regular methods to explore more in depth what people have understood from it. Thanks.
Great, thank you guys so much. And now we'll sort of transition to our next set of presentations. And so we will start with Dr. Thies Cornelissen with WHO's Epidemic Intelligence from Open Source System team, who will be presenting on the social listening work that he's done using the EIOS system. So Dr. Thies, it's over to you. Take it away.
Thank you for the introduction. So let me share my presentation. So in this presentation, let me see how I started. Oh, like this, I think. Yes. Okay, so in this presentation, I will try to give you an update on the latest developments in the EOS system, in particular related to social listening. So first, some general context. So one of the main strategic objectives for WHO is to ensure global health security. And with EOS, we try to contribute to that by trying to detect and respond to health threats as early and quickly as possible. And that way, hopefully save lives and minimize the impact on society. And in fact, our ambition is in the end to be able to detect and respond to health threats so early and so quickly that they have zero impact on people's lives. And of course, we are still not quite there yet, but that is our ultimate goal. And also, we have a full mandate from the member states to perform this task. In 2017, WHO accepted to lead this EOS effort as mandated by the member states. Okay, coming to perform this, to describe this process of detection, verification, and risk assessment, to give an idea on the left-hand side, you see the different steps in this process. So starting on the top, going clockwise, initially you may have an indication of a possible new event or signal, which maybe in the beginning you're not quite sure yet what it is or if it is really a new event. So you start by trying to identify and get more information about it. And then when you are more or less, when you know more about the type of event you're looking at, you want to verify it. You want to confirm that it is really a new event or a new hazard to health. So if, for example, you can perform sample tests and see if the results from the test come back positive to confirm that there is really a new outbreak, for example. And once you have that confirmation, you want to respond to that. For example, you want to provide actionable insights to the local authorities or field experts. And now the approach that we choose in EOS is the what we call the all hazards, one health approach. So all hazards in the sense that we want to detect not only disease outbreaks, but in fact, we want to monitor all different hazards that can affect human health. For example, we also consider natural disasters, man-made disasters or conflicts, anything that poses a threat to human health. And we look at one health in the sense that we look not only at human health, but also at animal health and environmental health, because those can indirectly also affect human health. For example, we know many infectious diseases start by circulating in animals and then at one point can jump to humans. Okay, now coming to the EOS system. So as the name suggests, we perform our task by analyzing data from open sources, publicly available data, for example, news media websites. And now, of course, there is no lack of data volume, but there's a lot of low quality data, disinformation, which we would like to at least be able to separate from the useful data. And on the other hand, there is also data which we know would be very useful for us, but which we are not allowed to access because it's not publicly available. In particular, patient data in hospitals would be very useful for us, but we cannot access that yet, at least not with our current methods. We are studying ways to still be able to analyze that data even without having direct access. But for now, we can only look at publicly available data. Like I said, news media websites, but we are also starting since last year to look at social media like Twitter and Facebook. Now, this is what the public health intelligence landscape more or less looks like. So EOS is not the only system. There are also other ones like GFIN, the Global Public Health Intelligence Network by Canada, EMN, the European Media Monitoring System by the European Commission. They are all different in many ways, so they all complement each other. And we want not only to work on the EOS system itself, but also to be able to connect all these different systems to strengthen the public health intelligence function. At the moment, we do that by importing the articles from these other systems, treat them as an additional source for our system. But actually, this is not yet ideal. It is not enough to put all this data in a single place, because to get insights from all this data, you need to have not only the data elements themselves, but you also need to understand the relationships between these data elements coming from different sources. And so for that purpose, we are also working towards building this network that you see illustrated in the background of this slide. That will allow us to also have the relationships between the data elements and then allow us to put the data in the proper context. Okay, now here you see what the EOS system looks like for the user interface that we provide to the analysts. On the left-hand side in the screenshot, you see the time chart with the rate of articles coming into the system. As you can see, we clearly have a period before and after the outbreak of the coronavirus. After the outbreak, in the end, we had the rate of articles coming into the system increased by about 6 times compared to the period before the pandemic. And of course, that poses all kinds of challenges for the system, but also for the analysts who it turned out in practice, in many cases, they were no longer able to perform their task of scanning all these articles by hand and looking for new events because there were just too many articles. And on the right-hand side, you see the list of articles that pass the filters that are configured by the analysts. On the left-hand side, below the time charts, are the different filters that the user can configure. And on the slide, you see some statistics, just to give an idea how many of the amount of data we are analyzing. Okay, like I said, the analysts are struggling to deal with the massive amount of data that we are now getting since the start of the pandemic last year. And one of the tools we are now testing and developing since last year to hopefully assist the analysts and reduce and to make their work more manageable by reducing their workload is this algorithm that can predict if an article is likely to be credible or not by analyzing the style and the tone, the way the article is written. You see in the animation and the information exposed from the algorithm in the user interface in the test environment for our system. You see on the top, you see an overall score between 0 and 100%. And also in more detail, the algorithm tries to assign the article to one of these classes that you see. We have about 10 classes in total, like misinformation, propaganda, hate news. And this way we hope to help the user by being able to filter out this disinformation in the first place from the analysis. But another use case we have for this is that the user is then able to follow the spread of this misinformation over time and detect outbreaks of misinformation. Okay, the last new development that I would like to share with you, this we exposed to our users not long ago, earlier this year, the Twitter dashboard, where since about 1 year we are importing tweets from Twitter filtered for the coronavirus category, the same definition that we use for the main EOS system. And in this dashboard, the user can then apply various filters and also perform free text search. So you can, for example, perform sentiment analysis by, if you want to know, for example, what people are tweeting, discussing about side effects of corona vaccines, you can enter a few keywords in the free text search and you find the most popular tweets, and you can also navigate to as you can see, you can navigate to the original tweets that are the most popular ones that have the most retweets. And then on this last slide, you just see the same Twitter dashboard, when you see the different filters that people can apply. You can filter by country, by language, etc. And you also see the distribution across the map of all these different tweets. Okay, thank you. That is what I would like to share with you today.
Thank you so much for that. That was a very informative presentation on the EIOS system and how it's functioning in support of social listening. And so next up, we have Dr. Heidi Larson, who will be sharing a little bit about the anthropological approaches for offline social listening. Dr. Larson, the floor is yours.
Thanks very much. I'm just trying to pull up my, slides here, which I know you also have. Here we go. Can you see slides? No.
Not yet. I think Avatrol has pulled it up for us.
Okay, I have it. I don't need it. Let's see. Okay, I'm on the first, oops, that was strange. Great, thanks. Well, there was some discussion of the anthropological approach, but I think the main thing that I'm an anthropologist, my training particularly focused on risk and decision science and trying to anticipate risks and avert disasters before they happen. But that's the dream. But that was when I founded the Vaccine Confidence Project 11 years ago. The idea was to build on, and it was very helpful to have Tis's presentation just before, because basically we built our rumor monitoring model based on GFIN, ProMed, Health. We collaborated with ProMed and HealthMap, looking at how media monitoring was being used to pick up signals of disease outbreaks. But we were looking at for signals of rumor outbreaks. And this was inspired by my having done a lot of crisis management in UNICEF, where we got there way too late in terms of vaccine rumors and ended up having to deal with a confidence crisis and drops in vaccine uptake, and in some case, disease outbreaks, like measles outbreaks. And there were usually earlier signals, and this has been talked about in a number of the presentations. We're in a very different environment now. There was no social media when I was initially doing this at UNICEF, and that's clearly changed the landscape. And even since we started at the Vaccine Confidence Project with our rumor monitoring, using this similar platform and developing it and trialing it with ProMed and HealthMap, we also faced the growing, and this was just with news media monitoring, the growing issue of coding, because there was a lot of ambiguity, and that has become even more hyper ambiguous in the context of social media. So we've learned a lot of the limits of media and social media monitoring, what you can get and what you can't get, what you learn and what you have to be cautious about. And one of the things is the importance of knowing context, comparability, when, where, and actually who are you listening to? Because especially in the social media space, there's a lot more clues and cues than there used to be in the beginning, but there still are a lot of false identities. You really don't know necessarily unless people give you cues in the context of the text, and there are newer ways to find out geographically where people are, but it's a complex space. So it's really important to have some other context. And I know Eve in particular brought this up also earlier, and I think it's been referred to throughout. So what we work on in the Confidence Project and the Vaccine Confidence Project is doing a mix of large-scale survey work. We do focus groups, we do the in-depth interviews, and we do a lot of environmental scanning, like what else is going on in these areas, and also looking at local histories. The other thing is knowing, as I said, who you're talking to. And with these nationally representative surveys, we have a lot of background data on socioeconomics, demographic, age, income, a number of different factors depending on what we're collecting. So the kind of things you can do with surveys is, for instance, this was on willingness to accept a COVID vaccine, which is highly varied across these 32 countries. And we found that above all other correlates, age, education, employment status, the one that was the biggest lever of acceptability or willingness to take a vaccine was confidence and trust in how the government was handling the pandemic response. And those kinds of correlations you don't necessarily get. It's harder to get with social media. Although what you can do is then once you see Lebanon, for instance, has very high, definitely will not accept a vaccine, then you want to do a deep dive. And this is where social media can give you a little more of the insights on what's going on there. What are the nature of the concerns? And as has been spelled out very well in the previous presentations, the methods to get there. This was in a large study we did with Africa CDC on perceptions. This was, again, survey-based. We're now looking at some of these countries through different approaches to social media to characterize it a bit differently. But we did see, a lot of these reasons for not taking a COVID vaccine were not that different from the rest of the world. But then with social media, we could pick up on these themes that we identified with surveys and look for them in social media to see where it's clustering. The surveys also told us, well, what were the key disinformation threads? And where were they coming from? So it was clearly the younger 18 to 24. It was male respondents, those who were more skeptical about vaccines generally, because we asked a lot of other questions that would indicate the background skepticism about other health interventions. We also found that those who relied more on social media were much more likely to believe some of these rumors. We can't forget context. I think you've all said it in your own ways and different throughout the presentations, but we can't lose sight of what's going on out our doors while we're online in another country. These are highly emotive, a lot of these questions, but we can use cues and clues from these different sources to inform our searches. Where is the pandemic? This kind of pandemic denialism, which if you don't believe something exists, why would you take the vaccine anyway? Which is really one of the issues we're facing in a number of the African countries, but it's not just there. It's in London, it's in the US, it's in Germany, it's in, this is not uniquely high or low income phenomena. Again, these are highly globalized. We did a lot of work using media monitoring around Ebola vaccine trials in the last 5 years, and this was a retrospective investigation into how rumors in Ghana led to the suspension of 2 Ebola vaccine trials, and by the time they recovered, it was too late. They were phase 1, and there were enough other phase 1 data that the rest of the trials had moved on to phase 2 and 3. So basically, they never continued. And watched how these themes change over time. One of the things we've really learned is the volatility of sentiment, not just as was mentioned earlier, not just in terms of volume, but in terms of content, in terms of the nature of the concerns. People change their mind. People have different nudges, different information. We've been following, for instance, the social media and sentiment following the announcements of the AstraZeneca vaccine and the risk of blood clots. That caused our survey monitoring in Nigeria to plummet from 49% towards last December, saying they strongly agreed that COVID vaccine would be safe and effective. That dropped in March precipitously to 24%. With every day, there was more information. So we have these external influences that are come in and can shake a system.
1 minute left.
Okay. The other thing is there's a lot of information in some of these protests, in some of these placards. You get a clustering of, what I like about this image is that it hits on a number of things from the motives, the financial motives, the controlling risk of autism, the safety, even I serve in education, how they can, if you want to go to school, but you don't want a vaccine, what does that do? Billboards, this is more and more, we see these anti-groups going offline, so we can tidy up social media, but it's not going to go away unless we're dealing with the roots. This is a documentary film on TV in Denmark. TV is the #1 source of information in our survey across Africa. Radio is #1 in West Africa. This is, I'll just end here. This is my book, Stuck. It talks a lot more on the whole approach of multi data sources and rumors and the power of emotions. Thanks very much. Oops.
Thank you so much for that. That was a really great presentation on offline social listening. We do have a few questions that came in. So just 1 second. We have a question for you, Heidi, about what are some of your top tips for public health teams for triangulating digital social listening data and offline ethnographic data?
Well, I think you go back and forth between them. There's no quick tip, but I would be happy to follow up on that. Basically, we try to have parallel methods going on, but communicating along. I think the important thing is to be having the cross communication throughout the data collection process, because they can inform each other. I think the problem has been in the past that you get these different streams of data that you compare them when you have your results. Where the value of it is you can pick up something in your ethnographic data and don't wait till the end, go to your social media counterpart and say, are you seeing this? Or you should look for this. And vice versa. Social media, because it's so real time, can come and tell the field workers or the survey people, listen, you should investigate this. We see something emerging. So it's important to do it early and keep those, set up a system, which is what we did in a number of these Africa settings in the trials, is we had our network of community listening, actual people listening and meeting with clinic people, giving that keys to the social media monitoring, and where we were doing any kind of survey work, making sure that these were real and current issues.
Great, thank you, Heidi. That was excellent. I just want to reminder to the experts on the call today, feel free to keep answering questions in the Q&A chat. We do have a couple questions for Dr. Thies Cornelissen. The first one was really about, public health intelligence and the detection of signals and new threats. So on the one hand, social listening tries to identify.
Hello, you were cutting out for me at the end.
Yes.
I was answering another question, but which question would you like me to answer?
Muriel, you might need to reconnect. So I'll pick up the question for the moment. So I think the question she was going to ask, so public health intelligence has tried to detect signals for new threats, but on the other hand, social listening is trying to identify signals of the infodemic, confusion, questions. So curious to hear your thoughts about which direction you think the computational methods are developing in. Over.
Sorry, I don't see the question on my screen.
I can ask the question again. I think I may have lost connection briefly there. So the question was about, which direction, in your expert opinion, do you think computational methods are developing towards in terms of social listening and identifying signals related to infodemics and confusions that may arise?
Yeah, I think what these tools that we are providing now, starting to provide now, for example, they will allow us to get better insight in what people are experiencing actually in their daily lives, and not just what we hear from the official channels, official governments. And for example, that could help to convince people to use the vaccine, even if they initially distrust what they are hearing about it, if they see. So in this way, this tool could be helpful to get more buy-in for anti-COVID campaigns, for example.
Great, and we have another quick question for you. People are interested in how the tool is being used now, and who can actually use the tool, the EIOS tool.
Yes, what we are doing, we are slowly expanding the system. At the moment, we have a limited number of member states who are participating in the system. And so each time we add a new member state, we provide access to the analysts from the country office in that member state. But if you're interested, please send an email to our generic email address is eos@who.int. So if you or your country office is interested in joining, you can send a message there and we will pick it up.
Great, thank you so much. And now I would like to just transition us and introduce my colleague Atsu Ishizumi, who will be taking the moderating torch and introducing us to our next set of presenters. Atsu, over to you.
Great, thank you, Muriel. And thanks to all of the presenters who presented so far. And we still have more exciting speakers lined up for this conference today. So first up, I'd like to introduce Mr. Matt King, who's at Marmorate, and he will talk about social network analysis for identifying bots. So Matt, the floor is yours.
Great, well, thank you so much. And I've got to now somehow try to live up to that expectation of being an exciting speaker. I know we're short on time, so I will jump straight in and then answer any questions that we have at the end. We're going to talk about bots and COVID misinformation, and within that, of course, how we can detect them, that touches on network analysis along with deep learning as part of artificial intelligence. So I just wanted to open with the question to ourselves, really, of what is a bot, because I think sometimes there's a very skeptical view of them in general. And I think starting from a shared definition is a good place to start. So simply put, short for robot, and a piece of software that automatically carries out a task. Now, what that task actually is, of course, depends. And so often when we hear bot, we're thinking about this malign social media bot that is somehow corrupting everything that we see. But a bot, like many tools, has lots of different uses and can be used for positive social change or negative impact. And so I'm sure that most people here will be familiar with at least some bots, whether it's a chat bot on a website that enables the user to give feedback, whether it is the likes of Siri or Alexa that acts as a voice bot, or whether it's in medicine where they're being used to do things like support people with mental health issues. And in fact, that isn't entirely new. One of the first chatbots, Eliza, was created by IBM in the 60s to do exactly that. Now, it was incredibly rudimentary compared to what we see today, but the concept itself isn't new. But of course, on the other side, we see bots being used for malign intent and often for criminal intent, collecting our personal details, email addresses, passwords, conducting very simplistic cyber attacks, or spamming us. So how it can be used really changes. The focus that we are talking about really, I guess, though, is how bots are involved in the infodemic and in social media. And so I think at its core, bots are really there to replicate human activity. So if we think about the sorts of things that a user would do on social media, they might create content, interact with users, comment, get involved in a conversation, or they might amplify content that they like or dislike for some reason. And those are the sorts of activities that we see bots take part in as well. Now, I should say that the first two elements of that, creating the content and interacting with users, is actually much harder generally to automate. And yes, there have been trials, and lots of big companies have demonstrated some pretty good capabilities. But on the whole, at the moment, I would say that the majority of the time, the role that we see bots in is that last role. It's in amplifying the content. And I think at this point, it's just worth drawing a slight distinction, because we have bots that are these pieces of software automatically carrying out a task, but we also have bot-like activity, and sometimes differentiating between something that is entirely a piece of software conducting an activity automatically and something in between, sometimes referred to as a cyborg, that has some human interaction, or a human acting in a very bot-like fashion. Drawing those distinctions in terms of detection can be quite difficult, but also in terms of the impact. So it's just worth keeping in mind as we talk about this subject. So when we think about what bots are doing out there, potentially rebroadcasting, amplifying content, what impact do we actually see it having on social media? Well, I would say there are two main parts to this. And the first really key part is that they create this artificial perception of popularity. And by that, I mean, it's not popularity that is organic or driven by humans directly because they're interested. It is the perception of popularity that we would see if we're looking at how many retweets something has got, how many reposts, how many comments or similar. And when bots act in this way to create this artificial perception of popularity, it has two key benefits for them. So the first is algorithmic. So often the platforms themselves will reward content that appears to be popular. So whether it's Twitter trending or more visibility, that's one aspect of it. And then the second part is the very human part. So there are psychological benefits conveyed by that artificial perception of popularity. And by that, I mean that humans are more likely to engage with and to interact with, to retweet themselves, content that already appears to be popular. And there are lots and lots of good pieces of research out there that set out the psychological traits behind that. And so all of that means that while we start with an artificial perception of popularity, it then potentially drives real popularity. And that's a really key point for us. The second part is that there's been some good research on showing that how, as bots proliferate within a network and how the content proliferates, we end up with a poorer quality of conversation. We end up with the good content being suppressed and actually the poor content becoming the majority in that network and taking over the role then of what is shared. So I think the takeaway for the impact of the bots is that the artificial popularity actually drives real engagement. And secondly, that information overload decreases the quality of the overall conversation that we see. So when we're looking, and I think people previous to this have already talked about early detection, how do we actually identify them and identify these sorts of artificial amplification early? Two main methods that we look at. The first is network analysis, and the second is machine learning. So I think I've got, I think there are a couple of people that are following this that are actually going to talk about social network analysis in more detail. But for those that aren't familiar, in very basic terms, a network analysis is usually conducted by looking at a graph. And in that graph, we have a circle, which would represent an entity, and a line to another circle, which would represent a relationship between them. And if we think about social media, that might be a Twitter account, and the relationship between them is that one of them follows the other or that one of them retweets the other. And when you add all of those together and you look at a conversation on a much larger scale, what you end up with is a network graph like the one you can see on the right of this presentation. And so when we're using this approach to identify bots, we're looking at lots and lots of different features. And just a couple of them I've drawn out are things like the position of that account within the network, the role it plays. So is it a seeder of information? Does it act as a bridge between two communities? What role does it play? And then how is it connected? Is it only connected to other accounts that in turn exhibit bot-like behavior? Or does it have a rich and diverse number of connections to others that are very likely to be humans? So we look at all of these different features in order to try and identify bots or bot-like behavior.
1 minute left.
And the last or the next part of that identification is using machine learning. So instead of looking at the network, now we're looking at individual accounts, the language they use, their activity, their use of emoticons, and we're building deep learning models that then are able to identify bots or bot-like activity based on that. And on top of all of that, we then layer other AI models to try and detect things like the categorization of misinformation. So rather than just, is it misinformation, yes or no, actually looking at the different types. And then lastly, I'll just leave this up, is an example of what that looks like when we identify some misinformation. And you can see a bot network being identified. And if we had more time, we could start to talk about how those patterns emerge and how they can be differentiated from an authentic looking network. So that's it from me, hopefully just about on time, and I'm happy to take any questions.
Great, thank you, Matt. That was an excellent overview of the impact of bots and what we can do to address them. Our next presenter is Dr. Wasim Ahmed from Newcastle University. And he'll be talking about using social network analysis for social listening. The floor is yours, Dr. Wasim.
Great, thank you very much. Just share the screen now. So thanks for having me today. I just want to talk about the methodology social network analysis, and I know it's been mentioned previously in the conference, so in day one, and just in the previous talk as well. So I briefly just want to talk about how social network analysis can be used for social listening, and then talk about some of our research which use this methodology to study misinformation networks from the start of the pandemic, and some of the insights we were able to get from that. So social network analysis is essentially the process of investigating social structures by drawing upon network and graph theories. So it's been used a lot in sociology before the advent of social media platforms to understand relationships between communities and different groups in different settings. So for instance, you might go into an organization and speak to the different people there to kind of draw up a social network of how people are connected to each other and who influential employees might be. And due to the advent of social media platforms, people began to use this method and apply it to social networks. And there's a number of different tools and software applications that allow anyone to easily tap into this social media data and perform social network analysis on these data sets. So this is an overview of a network visualization, and essentially social network analysis by exploring the relationships between different users around a given topic, account on social media, YouTube video, and so forth. By examining how people are conversing and talking to each other, we might uncover kind of the groups and key users that are within the network. So for instance, we might use different metrics to find out who the most influential person might be. So for instance, one metric is betweenness, centrality, and that might tell us which nodes or users in a network are spreading information the most. We'll also be able to find out the key discussions the core group are having. And when we are studying misinformation, we can isolate and kind of analyze accounts that are most influential in these groups. So we might use it for a kind of grouping key discussions, highlighting popular information sources, and kind of isolating them and seeing what types of information they might be spreading. And it's a useful method to use alongside textual analysis as well. And it kind of gives some additional insight into the network. And due to the availability of many different tools, one of the nice things about it is that almost anyone really with an internet connection can start to produce these network graphs. So kind of health authorities should hopefully be easily able to kind of produce some of these visualizations. And what social media researchers have found is that when it comes to topics discussed on Twitter, there might be kind of main patterns that might emerge, not just on Twitter, but perhaps on other platforms as well. And our network insights and visualizations can kind of give us insight into the structure and nature of a given topic. So for instance, we might find that some groups or some network graphs represent broadcast networks where we might get a group of influential users spreading misinformation, and we can see in the network that their purpose is to kind of broadcast this misinformation. We might get polarized crowds. So for instance, we might get a group of users kind of positively talking about vaccines. We might get a group of users against vaccines. So we might find kind of examples of polarized groups. And there's other shapes that might emerge as well. So a support network is where one user might be replying to a large number of other users. So for instance, trying to tell people about a misinformation. So in our research, we also found that accounts will try and tweet as many users as possible to kind of tell them about misinformation on social media networks. So this kind of a network visualization of these 6 shapes was produced by the Social Media Research Foundation, which analyzed thousands of different topics on Twitter to try and come up with different ways to see how networks might look like. So there's different tools that people can use to analyze social media data from different platforms, for instance, Twitter, YouTube, and so forth. And one open source free tool that anyone can really start to use and find kind of patterns in these networks is Gephi, freely available, and allows kind of importing data and analyzing it. There's other tools as well, iGraph, UCINet, and Node XL as well, the Microsoft Excel plugin. So in our research, we've been mostly using Node XL, and we have been studying misinformation networks on different conspiracies. So one conspiracy we looked at was 5G and coronavirus, where we looked at the relationships between different users in the network. And we also looked at another conspiracy theory, the Fermi Hospital conspiracy theory, that kind of clustered users into the different groups and so forth. We also found that when we look at a particular network as it emerges, once you remove the accounts that are spreading misinformation, we might see a group on the right-hand side. So networks, when we remove misinformation from them, they really look kind of empty. So we published our research in the Journal of Medical Internet Research, kind of at the start of the pandemic. And by producing these visualizations, we're able to identify key groups of users who might be kind of spreading misinformation. And you can use social listening for other things as well. So for instance, the general World Health Organization Twitter account, we could actually put that into NodeXL, produce different visualizations, and actually look at the connections between different users and groups, find out who the most influential people are in that particular discussion. We can also, for instance, use social network analysis to look at the likes of YouTube user discussion networks as well. So for instance, we could see what the most commented videos are on YouTube and explore the network, see the kind of key groups and divisions that might emerge. So there's a number of data sets around health, misinformation networks, World Health Organization, and public health more generally on the NodeXL graph gallery that might be of interest to some of you are kind of working in this area as well. Our publications are also available on the Journal of Medical Internet website, where we've looked at a number of different conspiracy theories. So that's it for a kind of overview of social network analysis. Happy to take any questions.
Great, thank you, Dr. Ahmed. That was a very informative introduction to social network analysis and how we can use it in infodemic management. Thank you. So our final speaker is Mr. Rory Smith from First Draft News, who will be talking to us about social listening tools and tips. And also a reminder for everyone to use the Q&A box to ask questions. Okay, so with that, please, Rory, take it away.
Great, thank you very much. It's great to be here. And I will today do a very kind of whirlwind tour of some of the social listening tools that are available and that are generally free for anyone that's monitoring social and doesn't necessarily have all the resources in the world. A slight caveat beforehand, given where we are these days and given how many brands and companies and organizations are doing this, that the tools available are seemingly infinite at this point. So this is very much like a curated list of things we use at First Draft that might also be very helpful for anyone doing this work. First off, I want to just underline the importance when doing this. Over the last year, having monitored kind of vaccine misinformation, health misinformation, we've pivoted a bit and focused more on narratives as opposed to the individual pieces of content. And while these individual pieces of content are important, what we see is they generally support broader overarching narratives that have kind of significant impacts on how people make sense of the world. And these narratives are important because they're not easy to debunk, but these are the heuristics that people use to make sense of the kind of environment that we're in. So understanding the narratives also allows us to better create kind of active campaigns to combat misinformation or narratives that are increasing vaccine hesitancy as well. And another important component is the focus on data deficits. So what I mean when I say data deficits is when there is a high demand for information around a particular topic, but credible and reliable information on that topic isn't necessarily available. And where there are data deficits, there are generally almost invariably kind of misinformation, rumors, speculation, all the things we've been dealing with over the last year. So being able to effectively identify these is really important part of monitoring and actively addressing kind of misinformation and rumor. So when doing monitoring, Boolean searches and keywords are absolutely your best friends. And if you do not nail this part of it, any monitoring operation is going to collapse. So by Boolean searches, I mean and or statements. So if you look at the top there, we have vaccine and Pfizer or AstraZeneca. And below that, we have a more kind of elaborate Boolean that looks at specific countries. Now, Booleans are only as good as the keywords, and oftentimes keywords are entrenched in certain communities or emanate from certain communities. So they're very much based on a set of kind of in-group vernacular. And developing keywords comes, unfortunately, only with doing lots of monitoring. So in order to understand communities, you have to monitor them. And then in order to get keywords that might signal certain communities that you're interested in monitoring, certain ones that might be pushing rumors or conspiracy theories, et cetera, you have to understand the vernacular they use. Otherwise, it's going to be really difficult to source your content and monitor effectively for rumor and misinformation. So first of all, one of the easiest and cheapest ways of monitoring is with Google Advanced Search Terms, right, and Booleans. So on the left side here, we just have a easy Google search. So if you're interested in sourcing kind of some of the main content that's about South Africa vaccine and Pfizer, or any of the other vaccines, you plug this in and you get a list of kind of the top content that Google is prioritizing here. Now, Google's gotten a lot better over the last year. Before, it was very easy to find misleading or outright false information on Google. Generally, that's not the case anymore. But this is a good way to monitor for news articles and content that might be problematic. And again, if you have keywords, you can plug in a few keywords, and then you can quickly see if there's more problematic content. So what I mean there is, let's say you heard a certain rumor about, or a certain conspiracy theory about, let's say microchips. You'd say, vaccine and microchips. And hopefully it would be authoritative information or debunks, but you might also find articles that are sharing false information that might also be being shared on social media. And you can also use Google search terms to find groups content on different social media here. So by using Google Advanced Searches, you can find specific groups that are talking about vaccines in different countries too. So if you don't have access to a lot of the kind of broader, bigger analytics platforms, this is a good way of sourcing groups, Twitter accounts, etc. So for Twitter, there are kind of two main options. TweetDeck is free. It's very easy to use. And as you can see there, it gives you kind of a multiple column layout, which you can organize using different Booleans, different searches. You can organize it any way you want, but it gives you a live kind of real-time display of tweets that adhere to the searches that you set out there. This is kind of the best way of monitoring stuff in real time, but you also have access if you do have some data chops or people on your team are a bit more kind of data savvy, to tap into Twitter's free search and streaming APIs, which essentially gives you also either real-time data or kind of a retrospective kind of look at data going back as far as a week to 10 days. For Facebook and Instagram, unfortunately, very much kind of hamstrung in terms of what we can access. Since 2016, both these platforms have done an amazing job at kind of black boxing their APIs and limiting access to data, unfortunately. CrowdTangle is one of the quote unquote best options. I say best in quotation marks because the data is very, very limited, but that's going to be the case for both these platforms whenever. CrowdTangle is free to journalists and researchers and also universities. And I'm pretty sure they're making it more readily available for kind of organizations monitoring this space. But if you cannot get access to CrowdTangle itself, which is an analytics platform, which gives you kind of a real-time feed of content on Facebook, Instagram, or Reddit, you also have the CrowdTangle link checker, which you can see here on the right, which is free for everyone. It's a Google kind of plugin you can download. And this allows you to essentially reverse link check articles to see where they've traveled through Facebook and Twitter and Reddit. as well as Instagram. And essentially gives you the interaction count, etc., which allows you to see kind of where the articles have traveled, and the types of groups or pages that are sharing this content. So it is a very effective and useful tool that we are constantly leaning on, especially when we see kind of suspicious or misleading articles. We want to see kind of the spread, the uptake, etc. So that tool is completely free and available right now to anyone that wants to download it, and it is a very effective tool. Whereas the CrowdTangle dashboards, you can contact CrowdTangle and see if they're able to give you access. Generally, they will if you're a journalist or a researcher, but it gets a bit more complicated if you're kind of an organization that's not necessarily associated with journalism or research.
1 minute left.
Yeah, and then there is obviously news media is very important. What we've seen in the last year is that lots of misinformation comes directly from, or the data deficits are essentially produced by the news, more so than on social media. So monitoring the news, monitoring headlines is a very, very, very important component to this. You have NewsWhip, which is a paid-for service, which gives you essentially the same thing. It gives you nice analytics on this stuff. But you also have free tools like the News API, and you can also do the same stuff with Google Advanced Searches. Lastly, WhatsApp. We can't do anything these days without also monitoring WhatsApp. You can do this for free, and we have a kind of a link on the right side to a YouTube video that shows you how to set up a WhatsApp monitoring operation from your desktop. And then, of course, you have the obvious Google Trends, which is very important. But also, don't forget about Wikimedia and Wikipedia. And they have an API which essentially allows you to monitor what are popular kind of searches and pages by language, which can be a really effective kind of tool on top of your other tools to triangulate kind of data sources. So there's also a suite of free monitoring tools at the University of Amsterdam and through the Digital Methods Initiative. I don't have the time to cover that, but they are incredibly helpful. They're free, and they give you tons of scope to investigate and monitor information across the web too. And here are some resources for you. I think this slide deck will be available, but we at First Draft also have kind of reams of training and tools and recipes to help you all in your monitoring and investigating. So thank you.
Great, thank you, Rory. That was a great presentation. So with the time that we have left, we would like to start our moderated discussion, but maybe we'll start with asking questions to the three presenters who just presented. And maybe we can start with Rory, since you just presented. So we have a question for you. So I think one of the issues that we are starting to see is that public health teams have are saying that it's important to hear as many voices as possible. And so what, in your opinion, what do you think are best ways to serve people in closed social media groups? Because this can be particularly challenging in terms of ethics involved for social listening. So can you tell us more about how you're handling ethical social listening in closed groups, Rory?
Yeah, thank you. And that's a fantastic question. So of course, when it comes to this, because for the type of monitoring that we're doing, which is often around kind of politically extremist groups or just extremist groups in generally, you need to enter closed spaces. And this is specifically, I mean, this is important because with a lot of the deplatforming that's happened this year, people are moving more and more to closed spaces. And we see a lot of people that are spreading kind of vaccine misinformation also moving to this. So ultimately, it's going to be a privacy versus a public interest argument, right? And if it is generally in the public interest, and you think whatever you're doing will serve the public interest and that will outweigh any privacy concerns, that's generally the kind of heuristic we use to kind of guide us. Obviously, there are many questions you have to ask. So when it comes to what we do, it's important to be as transparent as possible. So not to be misleading at all. And we're also very much in just a kind of watch situation. So we do not interact with people when we do monitor these groups. We're there only to watch. And if people do approach us, it's important to be, again, transparent, to say who you are, what you're doing, and why you're doing it. And, inevitably that might result in you getting kicked out, but that's fine, because at the end of the day, we want to be fully transparent. And it's also protecting people's privacy and making sure you're anonymizing everything you do, right? And not revealing or doxing people, because then we're contributing to the same issue that we're kind of fighting back against. Unfortunately, though, with this conversation, it's not cut and dry, right? It is a sliding scale of what is in the public interest, how far you're willing to go with entering these private groups. The most important part about this is that you and your organization are actually having this conversation. No one should be going out and doing this alone without having had discussions and having kind of instituted some policy at your organization about what you can and cannot do. But unfortunately, yeah, the issue we all confront is there are no central guidelines to how you can do this, aside from, for us at least at First Draft, being fully transparent with kind of our intent. And as long as you're doing that, and you think this is in the public interest, and that you have a strong argument that essentially substantiates that, then at least you're checking some of the right boxes when it comes to ethically monitoring. But for those that are interested, we do have an entire kind of module about ethical monitoring, and it's on our website at this link here. And it goes through a lot of the questions that you should be considering with your maybe your manager or your organization, and some of the discussions you should be having. So check that out, as that might be kind of a helpful tool for everyone that's trying to do this type of stuff.
Great. Thank you, Rory. So next, we have a question for Matt. So I think we are starting to see a theme across everyone's talks today, including yours, Matt, which is that this challenge of disinformation that undermines confidence in public health measures. And with this challenge in mind, what would you say are key tips for public health teams to recognize disinformation threats to health security? And what could public health teams do to help build resilience to these informational hazards?
Okay, so just a small question. I tell you what, let me bring up a slide very quickly. So I think this was an after slide that I prepared just as a question, I guess, which I'm not expecting anyone to actually speak up to, but the question was going to be, which of these is real and which is fake? And the answer is they're all fake. But detecting misinformation, I think, is only becoming harder for lots and lots of different reasons. There are this idea of deep fakes, like we're seeing here, which are computer generated, incredibly realistic looking images. But we're also seeing, I think, as Rory mentioned, a move to more closed groups. There is a differentiation, I think, to be drawn between misinformation and disinformation, where we're seeing potentially the intentional spreading of false information versus the unintentional spreading. And then there's I think, an argument around, is detection actually useful? How early do we need to detect it in order to be able to act effectively? and how much of our effort should be focused on building resilience and actually trying to get ahead of it. Personally, I think probably both, that we need to be trying to detect it as early as possible. And I think in order to detect it, it is becoming more and more difficult. And where previously we may have been able to identify a fake account because it had no profile picture, and then a little bit down the line, it had a profile picture stolen from a dating website. Now we're seeing these deep fakes that are incredibly difficult for humans to actually identify. And so we are having to use technology, which comes with its own challenges. I would say just that I'm also a big fan of pre-bunking, as I know debunking was mentioned, but pre-bunking, and particularly this idea of logical inoculation, where we expose members of the audience to a weakened version of the form of misinformation. So maybe not the actual, we're not talking about sort of trying to fact check a particular item. We're giving examples to the audience of a methodology in order to build their resilience to it and enable them to spot it more effectively. And there's been lots and lots of good research, and particularly on the environmental front around some of that work. So I think it's pretty obvious that's a topic we could talk about and explore for days, and in all sorts of different detail, but that's a quick overview.
Thank you, Matt. That was excellent. So our next question is for Washim. So I think one of the challenges that public health authorities are facing is trying to make sure that there's universal access to credible health information, especially in this environment where harmful narratives may be interpreted as more shareable than expert scientific information. And this can mean that public health messaging may not necessarily reach all the other nodes in a communication network.
Yeah.
So do you have advice for public health authorities to try and expand the reach of their messaging?
Yep. So what you can do is when you use social network analysis, sometimes what we found is there are some accounts that are sharing the anti-narrative against misinformation. So for instance, from a commercial point of view, brands might contact influential users on social media to kind of share messages on their behalf. So in some of our work, we were recommending the use of a kind of influencers on social media that are already got an interest in health, and maybe kind of collaborating with them to kind of share more factual information. And there were some examples in the UK where some local councils approached influencers to kind of spread more positive messages, and it seemed to have good reach compared to some of the kind of official messages. So another potential kind of channel of raising awareness.
Great, thank you, Washim. And maybe I'll hand it over to Muriel for more questions for the presenters.
Great, thanks, Atsu. I think Dr. Chris Czerniak may have a follow-up question for one of the presenters. Chris, over to you.
Thanks, Muriel. Can you hear me?
Yes, we can hear you.
Excellent. So while we were just chatting with Dr. Wasim here, I'm really interested in whether you find that these clusters are very dynamic or static for different public health topics. In particular, how often would you recommend, for example, that public health teams go out and do this kind of mapping work of their communication network? Over to you.
Yep, so that's a great question. So depending on the volume, something like the World Health Organization's network, it might actually change every day. So if you were looking at a 24-hour period from day to day, we might see changes in discussions and changes in the topics that people are conversing about. one way to test it out would be to maybe produce some of these visualizations on a weekly basis and a daily basis, and see some of the differences that might emerge. But because certain accounts get a lot of interest from the public, they might receive so much communication that it might be better to look at these things in a kind of a daily unit rather than over a longer time frame.
Great, thanks so much. I also had a follow-up question in terms of, for Dr. Tees, how can, educated people, including faith leaders, be convinced to take the COVID vaccine through the EIOS and LMICs, and they're particularly interested in India?
Okay, yeah, thank you for the question. I'm relatively new to this field, I must say, of social listening, and we started developing these tools since last year. But what I can imagine where these tools that we are developing in EOS could help, they could show the actual experiences with people have with these vaccines. And so I could imagine that if people distrust the official channels like the government, then if they actually see what people's experiences are with these vaccines, that could maybe help to convince them, and also save leaders who could then convince their followers. I hope that answers your question.
Yes, I think that answers the question. Atsu, do you have another question?
Yes, sure. Thank you, Muriel. So maybe this can be a question for Tina and Amy and Eve. So do you have any tips on how to translate actionable insights from social listening into priorities for action?
That's an incredibly good question. And it's something that, so I suppose to give the context, Media Measurement is an organization that historically has worked on analyzing social media content for a number of different reasons, but as with many in our industry, we started off with very much a focus on brand conversations. So a big part of the work that we've done with Tina and Chris and the rest of the team at the World Health Organization is figuring out how to apply some of that methodology that we use to track brand and category conversations and apply that to a public health use case. So that's been a huge part of the work that we've been doing over the past year. And really, I think we work very, very collaboratively with, particularly with Chris, so that we can look at the findings that we see on a weekly basis. So we report weekly. And we obviously are focusing very closely in on the content and the data set that is relevant to public health interventions. And then we work very closely with Chris and the team to translate that into recommended actions that we think will be appropriate. And of course, Chris adds a huge layer of expertise to that as well, so that we can make sure that when the information gets to sort of a broader set of recipients, that the actions are appropriate recommendations.
Great, thank you, Amy. And another question I think that came for you guys earlier on in your presentation was about emotion analysis, and if you can maybe dive a little bit deeper into that specific analysis that you guys are doing.
Yeah, absolutely. So we identify emotional language. So again, this is based on keyword searches to identify when people are talking about the specific topics in the taxonomy with a particular emotion attached to it. Now, we do that, as I said, with keyword searches. So, for example, with anger, it might have words around anger, fury, certainly a broad set of swear words and curse words, because people tend to use those when they're angry. And we use that to pull together data sets that indicates that people are feeling and expressing that emotion when they're talking about the specific topic within the taxonomy. As my colleague Lucy mentioned, we also use emojis that might be related to those emotions as well. So we have that data set, and it's pretty solid, but we also do need to do a layer of human analysis to sense check it and to make sure that what we're seeing is in fact sort of the expression of that emotion. So I think it's a really interesting data set to understand how people are feeling, because I think how people are feeling can very closely link to how they're acting. So are they likely to adhere to restrictive measures if they're feeling angry? Well, they're probably more likely to if they're feeling a level of acceptance towards the situation. So it's interesting and it's indicative, but it certainly is a data set that needs a bit more human analysis rather than just being taken at a surface level.
This is Tina. Atu, may I also add to this? So what Amy is getting at is actually a really hard question related to how do you link the what people are expressing with their intent for offline behavior. And what we've seen is that on emotional level, people express a lot more volatile emotion, which is also, Amy mentioned this, Heidi also mentioned it. That's not necessarily linked to offline behavior or in a very easy correlation. And similarly, as messages themselves are not linked to people enacting health behaviors. And this is where actually we don't have yet direct research, very clear research linking online expression, including emotion, to the intent and then enactment offline. So this is where I personally think multiple integrated research or integration of analysis from very different research strategies will need to be used in order to answer this question. And I think, Chris, you also had something to say.
Yeah, thanks very much, Tina. This is a great discussion. So this also harkens back to the question about how to try and prioritize. And one of the challenges we're seeing with the public health team feedback that we're getting is that, it's really difficult with all of the social listening data that's coming in and from all these different data sources which need to be considered and triangulated. How does one decide what to act on and what to leave? Because there are limited resources and we have to think about where is there going to be the greatest impact, where will there be the greatest return on investment. And so one of the things I can share that the team here at BWIN team at HQ does is that, we look at all of the insights that are coming in and all the signals, but then we have to do our own risk analysis when we're looking at those insights and consider what is the severity of harm and what is the probability of harm coming from some of these narratives. So for example, logging a bunch of different rumors and conspiracy theories, examples of misinformation, it's not necessarily the best use of public health team time to chase every single rumor and try to debunk it. It might be much more valuable to spend time identifying where there are critical information voids because people have genuine questions that need to be answered, and spend time trying to amplify that helpful information. And so once we do that assessment of severity of harm and probability of harm, then we also need to filter through and figure out what is the potential impact of an intervention. And that intervention, it could be communications, but it could be technical guidance, it could be logistics, health ops, it could be a bunch of different things. And then we have to do a feasibility assessment based on the resource available for the team. What can we actually do? And that helps us with prioritization. Over.
Great. Thank you, Chris and Tina. So we have a question about digital social listening examples for assessing how people are responding to a public health measure or campaign. And I would like to punt this question to, is Eve online?
I think she had to drop.
Okay. Sorry to ask you another question, Amy, but would you mind taking this one?
Yes, I can, absolutely. If you would give me one moment just to find my notes that I have for Eve's part of the presentation. Yes, I can absolutely do that. Sorry, bear with me just 1 second.
Sure. Muriel, did you have like another question that you wanted to ask the presenters while we are waiting?
Yeah, I guess
I have a quick question too. So you go ahead, Muriel, and then I'll jump in after you.
Oh, okay. All right, I guess I can start. So there was a question that sort of wanted to know, for example, when infodemics happen, the earliest information sources are not necessarily the most harmful, and the most centralized information sources may not also be necessarily the most prioritized or to be controlled as well. And so they were wondering, how to distinguish and determine the priority information transmission spreading, and how, that should be given to interventions and the measures for interventions. I hope that question was clear, but I think basically they're wondering how to distinguish and determine the types of information to prioritize during an infodemic.
Narrative, yeah.
Go for it.
So this is where the taxonomy, the idea behind using a taxonomy to help drive analysis, targeted analysis towards what a response team thinks about in mitigating epidemic risk and the epidemic. So first of all, we need to get away in the analysis. One does need to get away from pieces of information to narratives. Once you are able to identify the narratives, which are the ones that are rising, or where are a lot of questions, where is a lot of confusion, which indicates where potentially there's information that's not clear, and where there is the conversation space where misinformation can very easily move in. Once we think about the narratives, the next step is really looking at them and framing the analysis within the frame of, is the conversation about the cause of the disease? Is it about the treatment? So the way that Amy was describing taxonomy earlier, because this makes it a lot easier to identify those topics and those narratives that correlate to the response. So every epidemic response has an incident response structure where different colleagues, professionals of different backgrounds come together and they drive pieces of structured response, anything from logistics to diagnostics to treatment, knowledge about the virus. So being able to throw a blanket over the narratives and look where there is most confusion, where there's most answers, where potentially they are driving conversations, helps pinpoint and put the analysis closer to what can then have higher impact for consideration and also higher impact in the response.
That was great. Thank you, Tina. So Amy, did you want to address the question that I asked earlier? Just a reminder that the question was about social listening examples for assessing how people are responding to a public health measure or campaign.
Yeah, thank you so much, and apologies that it took me a short while to get back to Ev's slide. Hopefully you can all see that slide here. And yes, so these are two campaigns that were launched to communicate around the pandemic in Quebec specifically. Now, this first one on the left here uses an analogy with hockey, which obviously is quite a popular thing in Canada, to promote adherence to recommended measures. And the slogan was, "We're all in the same team." And they got a lot of criticism on social media. So Quebecers were criticizing that actually, you know, this campaign was really not recognizing the fact that a lot of people weren't actually in the same team in some ways. There were people who were facing significantly greater levels of difficulty managing the pandemic, and the pandemic has in fact increased some of those inequities that were already in place in terms of, you know, societal factors and health factors as well. So the reporting that we were doing was able to identify this, and they were able to kind of course correct, I believe, with some different messaging. And the second one on this slide here as well, they had a campaign again where they had a celebrity explaining how they kind of maintained their wellness, their mental health, their spirits during the pandemic. And again, sort of it was criticized quite strongly on social media, because it was felt that, you know, the conditions in which these celebrities were living in, you know, big houses, all of those kinds of things, really doesn't reflect how a lot of people in Quebec were living, you know, within the pandemic and the lockdown measures. So they, you know, the team in Quebec were able to take the information that we were able to provide them that measured the level of this criticism, and just kind of course correct these campaigns towards something that perhaps better represented the experience of more Quebecers during the pandemic. Over.
Great, thank you, Amy. Chris, did you have a question that you wanted to ask?
Sure, thanks. This is directed to Rory. I'm really keen to hear more about the challenges you're facing with the Boolean keyword searches that you're doing, thinking about how to try and do this kind of work globally. And, you know, for example, if we consider a team that's sitting in a regional office who's trying to scan across many different languages, right, for the countries that they're serving, that runs into a little bit of difficulty there with trying to have those search terms reflected in all the different languages. And Harry, I'm wondering if you want to come in on this and share any reflections about language agnostic approaches that can help. So to Rory and then to Harry, over.
Thank you, Christine. It's a great question. Yeah, I mean, at First Draft, we're doing monitoring in many different languages. And unfortunately, there is no workaround. I mean, developing your keyword list is so fundamental to monitoring and research. And you really, it's also the most time-consuming part. And that's why handing over lists of keywords to other entities is, it's like giving away, you know, lots of gold, and organizations can be very protective of them. So honestly, the best way to do it is to have people that are familiar with the context or have been monitoring the context in the language and coming up with different lists of keywords that are specific to each country and context. And I should say that even within each country, there are communities that will use certain in-group vernacular, right? So it's not even a country-specific thing. It's very much a community-specific challenge. And that's why it does take a lot of time and is quite tedious at times. But once you have those keyword lists up, it can really kind of just hypercharge your ability to monitor and do research. So that's my answer for it.
Okay, and adding to that, kind of coming from the machine learning side as well, most machine learning algorithms out there are not language agnostic. They're based on the language model for a given language, and most of them are designed for major languages, especially English or maybe Spanish. So that's why we took a different approach with city beats, which is what's underlying ears. And we're working on a language agnostic approach. So just by giving a few keywords, whether you give them in slang or local dialect, it will start adapting to that local context. So there are some ways to do it with things like classification. For some of the other things like that are very sensitive, like question detection or intent detection, then you need to specialize in languages.
Great, thank you both. Back over to you, Muriel and Atsu.
Thank you, Chris. So this question is really for Rory, but others can also chime in. And I know we have a few minutes left, so let's try to keep it short if we can. We have a question from a team who is currently doing some social media monitoring and, running some of the rumors and tracking programs in Asia, and they are looking to sort of jump in quickly to some of the needs that they are seeing in Asia, and are wondering, what's the fastest way to get up to speed in a new context as it relates to social media monitoring and rumor tracking?
Yeah, I mean, I'd say the most expedient way is really identifying which social media platforms are used the most. So this also differs very much by countries and regions. And so focusing on the ones that are the most prevalent, the most highly used is one obvious step to take. And then it is identifying what you're looking for. So if it's vaccines, then it's essentially coming up with at least a general keyword list to input that kind of essentially encompasses all the vaccine related terminology and debates that are happening in that country. And then through that, you will find more precise keywords that you'll be able to use to hone in on certain communities, certain issues. I would also, if you search, and this is easier done programmatically, but you can also, if you're looking for kind of concerns or questions, there's language that's suggestive of that. So if in your Booleans you search for supposedly or maybe, or even search for question marks, using kind of the language that suggests uncertainty is a great word or a great kind of method of really streamlining your search as well. And then of course, I mean, back to Heidi's point way back in the day, what we're finding out more and more is that, yeah, social is great. You can find a lot of things, but you're also very much limited by the data. And there is the data we get from these platforms is not great, right? So it's really easy to get a very distorted picture of what's going on. And again, to Heidi's point, like the importance of implementing kind of qualitative research, whether that's even focus groups, is a very expedient way of doing this as well, if you have the resources. And that can supercharge your ability then to do social, because you can get keywords, language concerns immediately. And then using that data, you can fine tune your kind of monitoring operations.
Thanks, Rory. A quick follow-up question here, and I think maybe I'll direct this to Tina. It's interesting seeing this incredible diversification of techniques and tools for social listening that we've covered here today. And certainly this raises questions about the ethics of social listening. And Tina, did you want to share a reflection on that?
Yes, maybe just really quickly. I saw there was also a question, or more of a comment from Gunther in the question and answer, where he was pointing out that there are actually ethics protocols and principles published in research. Researchers do need to submit their research to IRBs, their institutional IRBs, for review. And this is really important, really also in this context, because we do need to conduct and learn from communities and the methods that we do use for research, really from point of view of duty of care to them, showing respect and also protecting vulnerable communities that we do work with. So I just wanted, thanks for redirecting to this. We do need to acknowledge this. Social listening itself, it does need to be taken seriously. It's not a playground of throwing data analytics against big data and looking at information, but we do need to acknowledge our responsibility, not just to the communities and people that we work with, but then also we have duty to then act together to act on what we've listened from the and learned from the communities and apply them in response. We actually had this topic also included in the Infodemic management training. It is something that we do need to serve and acknowledge. And maybe we can share more resources on this aspect post the training, post the conference.
Great. Thanks very much, Tina. And this touches on a point that came up in Heidi's presentation as well, and is something we emphasize quite strongly in the Infodemic Manager training about trust as foundational to everything we do, and that trust is earned. And so I'm going to throw it to Atsu for a question that came up here from one of our participants about trust. Over to you, Atsu.
Great. Thank you, Chris. So this is a question for Harry. If you could please keep it short because we're running a little bit tight on time. So is there any real-time research being done to continuously monitor levels of trust between communities and the authorities?
Yes, that's something that we've started working on together with Chris and the team. So yeah, we've started detecting expressions of trust and expressions of a lack of trust, distrust, across 4 countries in our pilot with ears. We started by making a taxonomy with humans, specialists in trust, and then we've used machine learning to identify other common phrases that seem to turn up that are kind of similar, and then accepted them into our algorithm for detecting that. So that's something that we've started doing. Right now we're validating it and testing it in different environments in real time. You can see here in the slides, these are 4 of the countries we're looking at. You can kind of see how it evolves over time, as well as a heat map of people talking about trust generally in the conversation, or trust directed to a certain vaccine or a certain entity in the conversation.
Great. Thank you so much, Harry, for that. And this about wraps up our plenary discussions portion of today. I will punt it back to Chris for closing remarks.
Thank you very much, Muriel. Really good discussion today, and I want to invite everyone again to return for our final session tomorrow. Make sure you're registered. We are going to delve more deeply into the ethics of social listening and talking about challenges and opportunities to advance our coordination and collaboration in this space. It's going to be a really lively panel discussion after a couple provocative presentations. So please make sure that you are registered. And with that, I think we are at time. So thank you very much to everyone for attending today. Thank you for all the great questions. Thank you to the experts for addressing these and your great presentations, and to the technical support team here. And I look forward to seeing everyone tomorrow. Thank you.